Tuberculosis is a major public health problem and is one of the leading causes of adult mortality in Bangladesh. The World Health Organization ranks Bangladesh as the country with the sixth highest TB burden in the world, with 300,000 people infected and 70,000 people dying each year. TB is an infectious disease spread through the air from one person to another. The lungs are primarily affected, but in some cases TB bacteria can also spread to other parts of the body. The mission of the National Tuberculosis Control Programme of Bangladesh is to eliminate TB from the country, reducing morbidity, mortality and transmission of TB until it is no longer a public health problem. COMDIS, a research programme that is funded by the UK's Department for International Development, is supporting the government in these efforts. Bangladesh is working to achieve the global targets of identifying 70% of cases and curing 85% of patients who are suffering from TB. This is still a long way off. There is a lack of correct knowledge about TB, and people are unaware that it can be effectively cured. Most people still do not seek medical attention, despite having a persistent cough, one of the main symptoms. And when you don't know you have TB, you can easily spread it to others who share the same airspace. While the government has been trying its best to improve diagnosis and treatment rates in Bangladesh, they cannot accomplish this task alone. This means that public healthcare needs to be supplemented by private healthcare providers. For this reason, the National TB Control Programme, COMDIS, and 3 local NGOs jointly established the Public-Private Partnerships Project to combat TB in Bangladesh. Through this project, around 500 medical graduates have received a high standard of international training so that they can supplement the public healthcare system and provide effective TB diagnosis and treatment. This project specifically benefits the tens of thousands of clothing factory workers who are susceptible to TB in 4 areas of the capital, Dhaka. Mini TB clinics have been established within many of the factories. 18-year-old Hasina is a clothing factory worker and is one of the TB patients being treated through the Public-Private Partnership Project. Her success story is one of the examples of this collaboration. When Hasina's mother died a few years ago from TB, Hasina's older sister, Rubina, asked her to move in with her in Dhaka, the capital, so that they could be closer. In search of a better future, Hasina left her childhood village and went to work in one of the many clothing factories in Dhaka. She had a bright future. She could send some money home to her village from her work. All the needs of her family would be met and she would be happy. She went to a nearby doctor and was advised to take some expensive medicine, but she didn't recover. Witnessing the continuous deterioration of her health, a colleague from the clothing factory she worked at took her to another doctor, who had been trained through the Public-Private Partnership Project. Immediately after hearing about Hasina's symptoms, he suggested that she be tested for TB at the nearest clinic. She went there and the test was done for free. The results confirmed that Hasina was suffering from tuberculosis. Hasina was shocked. Suddenly she felt all her dreams were shattered. She thought she might die. Her doctor reassured her that TB is no longer an incurable disease. By taking her medicine regularly, she would be cured permanently and the treatment will be provided free of cost. As the treatment began, Hasina started feeling better and regained her strength. After 3 weeks, she was much improved. But, like many others, she felt so much better she decided to stop taking her medicine before her treatment was over. Soon she started feeling unwell again. She went back to the doctor. Hasina took another test and found out that she had in fact developed a very serious form of resistant TB. Multi-drug resistant TB had developed because she took her medicine irregularly and they were no longer effective for her. This is one of the main challenges to treating TB. Multi-drug resistant TB is fast becoming a health threat in Bangladesh. Hasina's treatment for this more serious form of TB began in Mohakali National Chest Hospital. For a year, Hasina received intense care and treatment from the expert doctors. During her treatment, project staff kept in touch with Hasina and regularly monitored her progress. Finally, Hasina was cured and could leave the hospital.
ওষুধ খাওয়ার পরে ডাক্তার আমাকে বলল তুমি সুস্থ সুস্থ এখন আমি গার্মেন্টসে ফেরা চাকরি করে বাবাকে খাওয়াচ্ছি সংসার করে খাওয়াচ্ছি আল্লাহর মেহেরবানিতে এখন আমি ভালোভাবে সংসারে মন দিচ্ছি আর আমার জন্য দোয়া করি
Now Hasina says, I'm stopping TB. Do you?